My career in Washington, D.C. started in 1992, sitting at the reception desk and answering phones for my home state senator, Carl Levin of Michigan. When I worked for Senator Levin, the Capitol was a very different place. There was a smoking section in the cafeteria. There were only 2 female senators, and women comprised maybe 20% of the senior staff on the Hill. The Office of Women's Research on Women's Health at NIH had just been established in 1990. The election of 1992 became known as the Year of the Woman. The number of female senators jumped to 6, and our issues were finally receiving priority attention. As my career progressed, I eventually was one of a handful of female legislative directors working for a female senator. I led the legislative team for Debbie Stabenow of Michigan. We often were a rare pair as we walked together into finance committee meetings or as we raced through the Capitol halls and I gave her the rundown on the votes for the day. Senator Stabenow taught me to walk into a room like I belonged there. Being a part of the discussions on landmark healthcare bills like the Patient's Bill of Rights and the creation of Medicare Part D in 2003, I saw firsthand how crucial women's voices are in crafting policy that genuinely addresses our needs. Looking back on my career, few moments stand out as much as my involvement in shaping the essential health benefits provision of the Affordable Care Act. During a very heated committee hearing on the legislation, a male senator remarked that he didn't need maternity care. I was sitting behind Senator Stabenow and jumped up to whisper in her ear, which prompted a swift response from my boss.
And will make the policy more expensive.
If I could just interject once with my colleague, I think your mom probably did, but...
Okay.
It was a pivotal moment that not only went viral, but underscored the crucial need for inclusive health policies that consider the unique needs of women. Being a part of those discussions, directly influencing legislation that would guarantee maternity care as an essential benefit, was more than just a professional achievement. It was a deeply personal one. As a new mother myself at the time, it brought the issues we were debating into sharp, personal focus. This work ensuring that women's health was not an afterthought, but a primary consideration in our health system, has been one of my proudest contributions. I am equally proud that I have spent the last 15 years working on access to life-saving medications and representing the pharmaceutical healthcare sector. The most rewarding part of my work at Amgen is forging strong partnerships with key stakeholder organizations, especially with the Society for Women's Health Research, a group that has always been my trusted source. Our collaboration on the Read My Lips public health campaign is a prime example of what we can achieve together. This initiative was not just about spreading awareness. It was about empowering millions of women with knowledge about their cholesterol levels, directly impacting their health and lives in a profound way. Beyond these campaigns, my efforts have always aimed to weave women's health issues into broader discussions of equity and access to care. As I continue my work in health policy at Amgen, my focus has increasingly turned to critical areas of unmet need, like cardiovascular and bone health for women. My aspiration is to keep pushing the boundaries of what we can achieve in women's health policy. Every breakthrough in research, every policy change, and every campaign we launch has the potential to save lives and improve health. The road ahead is challenging, but it is also filled with opportunity. And I am excited to see what we can accomplish together in the coming years. Thank you.